Okay.
Rightio?
Yep.
So this is when we first met you. That's a vertical slice of you, as if you're standing up looking at us. So arms above your head. They probably gave you the injection in your right arm, so that's a
Yep.
little bit of the black stuff.
Yep.
So the PSMA PET stuff goes to salivary glands and glands in the neck. So these are all saliva glands. So that's
Yep.
not from prostate cancer.
Yep.
It often will get taken up in your spleen or sometimes your liver. This is your right kidney, that's your left kidney. So all that black stuff is completely normal.
Yep.
There's a bit of uptake in bowel in around here, that's normal. This is the tube that goes from your right kidney down to your bladder. So that's got
Yep.
some of the PET stuff in it. That's the one from
Yep.
the left. And then this is your bladder. Part of it's a bladder. This bulgy bit down here is the cancer, the prostate
Right.
cancer. It's a bit obscured by your bladder in this
Yep.
picture.
Yep.
And these are these two bits in your bum bone,
Yep.
if you like, so left and right, they shouldn't be there. So
Yeah.
everything above that point is fine, but
Yep.
well, if you like,
Yep.
that bit's not.
Yep.
Then with the next scan we did, so this is all the salivary glands, blah, blah,
Yeah.
blah. And that area of the prostate has got better. You can't really appreciate it because it's kind of obscured there, but it's just this little bit down here. And these bits in the bum bones they looked a bit bigger, but they're a little bit bigger because they're getting destroyed, if you like, the cancer bits. This is now, so all of that black has largely gone away now from the bum bones.
Yep.
And the residual uptake we see there in the colour pictures is green, and that's consistent with kind of healing the bone.
Yep.
And the bit, this big bulky bit that was the primary cancer in your bladder, in the prostate, has pretty much disappeared.
Right.
So there's been a very marked improvement, and I'll just show you a couple of colour ones if you want. I don't know if you want to take a photo as well, or if you're happy with the video.
No, the video's fine.
Yeah. So if we look at you in splendid Technicolor, let's go back a bit. Where are we? There we go. So it's the same sort of thing with you standing up looking at us, but these are slices that we're progressively going backwards, and
Right.
we're using the colour. So it's your brain, arm, liver, bowel, heart, right lung, left lung. This is your bladder. So instead of the black, this all shows up as a red. So these are the glands in your saliva glands. So that's normal. It's a kidney, it's bladder, that's normal. It's your other kidney. So everything I've shown you so far is relatively normal. So the bits in the bum bone, that's all that's left, is this little faint green bits from that. I'll show you intensely red area that was there before. So that sort of faint greenish, yellowish bit, you often will see that PET uptake in things that are healing rather than being destroyed by active cancer. Similarly, in the actual prostate itself, that's your bladder. So there's all that's left is just a little bit of this sort of yellowish, faint stuff there. If we go back to, this is your last scan, Gary, not even the first one, because I can't, they were done elsewhere, so I can't import them. But so this is from November, from 2.5 months ago. Same sort of thing. You look standing up, liver, brain, bowel, salivary glands, bladder, and so that's still some active area in your prostate there.
Yep.
That red bit.
Yep.
And then in the bum bones, you can see that red. So the
Right.
red tends to indicate active cancer.
Right.
So all that red gone now.
Wow.
Wow. Yeah.
It's fantastic.
And so I guess the question that we will have now is, what role is there for doing, radiation to that, and probably the bum bone bits as well, as a consolidation.
Yep.
Oh, actually, I should go to the current scan.
Yeah.
Is that something that would be recommended to do now, or is that something that we hold off and see, because we might find progressively your PET scans go back to bog standard normal without radiation? So that's a question for smarter people than me, and we'll try and answer that at our meeting and get back to you. So this is now
Yes.
4 days ago in colour. Yeah, so it's that faint bit there and just the greenish bit in the bum bones.
Excellent.
It is excellent.